Welcome to the Did You Know podcast, where the focus is on rare diseases, how modern medicine is treating these conditions, including the latest breakthroughs in research, and how people cope with their diagnosis and healing. Your host is Dana Morrow, known for her video series on YouTube, Twitter, and Facebook called Did You Know Ataxia Facts? 300 videos have been produced and seen in 17 countries to date. And now, your host, Dana Morrow.
Hi everybody, we're live from the 11th annual Walk and Roll for Ataxia down here in beautiful Bristol, Rhode Island. And I am privileged to be sitting with Melissa Biener. Melissa is from Biohaven, and you're the Biohaven medical lead in the Ataxia program, is that correct?
That is correct.
That's correct. Yes. And with Dr. Jeremy Schmahmann from Boston. You are at Mass General in Boston, and you are the head of the Ataxia unit there.
Yep.
And so we wanted to bring you both together because we understand that you are working together on a few things, and we wanted to bring those things to the community. So welcome, and tell us a little bit about Biohaven and the history of Biohaven in ataxia, for ataxia.
So Biohaven is a clinical stage pharmaceutical company, and we focus on neurologic diseases, so diseases of the central nervous system, the peripheral nervous system, and one of our areas of interest within these fields is ataxia. And so ataxia, even though it affects over 100,000 people in the country, it's been overall a very poorly studied disease with respect to other central nervous system disorders, and there's been a paucity of clinical trials in this area. So from Biohaven, we're very happy to say that we did pioneer the first registrational trial, the first clinical trial in ataxia in patients with spinocerebellar ataxia with one of our drugs, troriluzole, and that study is completed. And what was great about pioneering that study is what we're able to bring forward now with what we learned from it. So in using our drug in these patients, at the end of our placebo-controlled trial, even though we didn't meet the criteria set forth by the FDA, showing that our drug showed improvement, we, over the long term, broke down that data and then looked at our long-term data, and we really showed trends that suggest that patients who were on our drug did not have as rapid a progression of their disease as they would have without the drug.
Oh, that's
their
great.
decline was, the study suggested that their decline was much more slow. And so we learned that about our drug, but what was more important is even if these clinical trials, at the end of the day, we're not seeing an effect of the drug, what we're learning about is more about the pathophysiology of the disease, more about the differences of all the disorders within the field of ataxia, and how we can design future trials that are useful and efficacious for studying drugs in this patient population. So we did learn these things from our trial. We're setting up another clinical trial with the same drug, learning lessons from that study that we did, and we're really excited now about a new study design that we think is really going to show the potential efficacy of this drug in this patient population. And we are collaborating with the ataxia community as a whole. We partner with the National Ataxia Foundation, and we work with the clinicians in this field across the country at these academic centers. We have a project with Dr. Schmahmann, and Dr. Schmahmann also has his patients participate in this clinical trial. And it really is a unique community in the sense that these physicians, these neurologists that are really on the front lines of this disorder with their staff and their study coordinators are some of the most dedicated, collaborative people we've seen in any field. And it's just an absolute pleasure to work with them, pleasure to work with NAF, and also to see these patients who are so resilient and so inspiring. And every little step we take with these clinical trials, every little step we take with the natural history studies that Dr. Schmahmann's going to highlight, it really brings greater awareness to our communities, which we're lacking in right now. We need more of that for these patients and for their families, and also to the scientific community.
Yeah, that's really great. And I think you're right. I think that a lot of times a patient is diagnosed and they feel the shock of that diagnosis, and so they're kind of frozen for a period of time, and they really need to get out and to just be with other patients that have similar things to find out that they're not alone and that there's a lot that they can be involved in that might help to find things that might lead to a better quality of life, as you had said. Yeah,
that's right. And the more we bring awareness to the disorder, and the more these support groups and these supportive communities spring up across the country, the more resources we're bringing to these patients. And I'm sure Dr. Schmahmann's going to speak to that in a few minutes. Even a patient we met here, oftentimes if these patients aren't at academic centers like Mass General and Dr. Schmahmann's unit, or UCLA and a host of those centers across the country, there's really a lack of information out there. And we need to be better about that as clinicians and researchers in bringing that to the fore. And that's part of the reason why Biohaven is really inspired to be a part of this.
Yeah, no, and you bring up a great point. And that's why this forum also works well, too, to get some of the word out about what is happening in the community, what's being worked on.
That's right.
Yeah.
Right. Well, thanks, Dana, for doing this, and great to have you as part of the Cerebellar Institute at Mass General Hospital that's now becoming a reality, the MGH Ataxia unit that's now growing and expanding. I've been in this now for 3 decades, and it is exciting, to say the least, to have a company like Biohaven and Mellisa and the rest of her team who are helping to spearhead the first drug trial in ataxia. This is something we could not have imagined 30 years ago. We imagined it, but it wasn't a reality. And now that we're having it, we're excited. We're seeing impact, and it's a sea change for our patients and the ataxia communities. Some of the things that we're learning from our patients in a very real way is the need not only to increase the awareness of ataxia among patients and the patient communities and the general population, but sadly to teach our colleagues what to do with a patient with ataxia. And it drives me truly crazy to hear people reporting that their doctors say, well, you have ataxia, there's nothing I can do. Because there's always something to be done. There are so many current approaches to improving life, to making every day better, to working with rehabilitation interventions, to using medications we have available, providing emotional support, and even being there to let families and patients know that this is something we understand, we know about, we're learning about, we are empowering you to be proactive in the management of the disorder, in learning about the disorder, and being truly an expert by experience to become a research collaborator in the extending our understanding of these diseases and their treatment. So we have a lot of work to do, both in the patient communities, caring for our patients, and what we'll be doing in the Cerebellum Institute at Mass General, which is an emerging reality now from the ataxia unit, is to engage in education and outreach, not only to patients, but to physicians, our colleagues, and the trainees as well. And the trainees are an important part of this because they're the next generation of physicians who will do a better job than we've been doing so far in diagnosing and treating ataxia. So a couple of things I want to share with you and the listeners is that what Biohaven has done in terms of the drug trial has been fabulous. They have seen the importance of the patient-reported outcome measure for ataxia that we have pioneering at Mass General. Biohaven will partner with us in making this a reality. What this requires is meeting with patients in a number of focus groups, which is stage 2 of our study. We've already done stage 1, which is learn from people who have ataxia what their symptoms are. And the purpose of this is to derive a questionnaire that people who have ataxia can fill out in response to their use of a new medication. So rather than just the doctor saying, here's what I think you are doing in terms of your exam and what your symptoms are, we're going to hear from people themselves who tell us, this is the same, this is better, this is worse, here's what's improving, here's what's not. So it becomes an important piece of the diagnostic ability to figure out, is the drug working or not? Because the ability to figure out if a drug is working or not is key. And does it make a difference to quality of life? So the PROM ataxia is one study we're doing now, embedded in all the others that we're doing in terms of basic science of cerebellum and cognition in cerebellum. But the PROM ataxia has rubber meets the road kind of relevance for the drug trials. And then the other point I want to get to your listeners is the importance of taking part in the natural history studies. This is new. It's hot off the press. It's part of the National Ataxia Foundation supported clinical research consortium for the study of the cerebellar ataxias, or CRC-SCA. There are now about 25 ataxia units around the country. I was the first to get this going as a real thing back in the early 90s. Now they're all over the place, which is great, and we have people interested in ataxia as a specific feature. What we're doing across the country is we're studying all the ataxias in a prospective way. So we want patients to enroll in this. All the ataxia units around the country are engaged in this to learn about what happens over time, the natural history of the ataxias. That's an important stage for the clinical trials coming down the road. Superimposed upon that is an NIH-funded study that there are a number of centers around the country involved in that are looking at a few of the ataxias, SCA 1, 2, and 3 in particular, in different studies, to look at when the disease starts to cause trouble. So the earliest stages and also the pre-manifest stage, someone who has the gene but doesn't have any symptoms. And the reason that's important is if you look at the MRI and the chemicals in the brain and blood tests, and in some people who want to do it a spinal tap, before the symptoms even start, when gene therapy comes, and it is coming, we'll know who to treat, how to treat, and very importantly, when to treat. So this is a really important study that needs to be performed, and we can only do it with our collaborators, the research experience people who have the disease, as part and parcel of the research team. So if you're hearing the podcast and you have an ataxia, especially SCA 1, 2, and 3, as part of these natural history studies, and any of the other ataxias for the NAF natural history study, as one of the advertisers in Boston would say, come on down. We need you. You're part of our group. You're our experts by experience, and we can't do this without you. We're doing it in a sense for you and with you, but we can't do it without you.
Yeah. And how would someone, where would someone go to reach out and say that they wanted to be part of that natural history study? Is it that they go to one of these ataxia units that are participating in it? Can they get that information off of NAF's website?
Yes. So if you're in the New England area, you can reach us through the Mass General Hospital Ataxia unit. We're readily findable. But if you're anywhere else in the country, if you look at the National Ataxia Foundation website for the natural history study, you can find where these ataxia units are that are closest to you. And because these visits are basically once a year, you could make a day trip out of it, go to a place that's maybe a number of hours away, and be part of the study. It's going to be really important, helpful, and we can't do it without you.
That's fabulous. I would like to thank the both of you for joining me today and for bringing this information to the forefront. Very informative, and hopefully people listening will follow up and become part of that natural history study.
Fantastic.
Yeah.
Thank you
and
very
thank
much
you very
for
much
having us.
for all the work that you're doing at Biohaven to really collaborate on ataxia. It's really fabulous.
And thank you for letting us be part of this community.
All right. Thank you.
Thanks, Dan.
Thanks.
Thank you for listening in to the Did You Know podcast with your host, Dana Morrow. Please subscribe to this channel to hear all of the latest podcasts. We hope that this podcast has provided you with valuable information and inspires you to advocate for yourself and educate everyone in your circle. Remember, you are the expert and best spokesperson for your rare disease. Thank you.